A ruptured ectopic pregnancy is when a fertilized ovum gets implanted outside of the uterus. Usually where that ends up happening is in the fallopian tube. The major danger here is that if the tube ruptures, it could cause a severe internal hemorrhage. So very important that if this were to ever happen, then it would be treated immediately, as it could result in death. So it's very important anytime you get syncope or passing out associated with abdominal pain in a woman of childbearing age, you always have to make sure that you refer to make sure that this has not happened. The female athlete triad, which we'll spend a little bit of time on, obviously very important because of, again, the typical population most athletic trainers deal with in young active individuals. Female athlete triad is a combination of three different issues. It's a combination of disordered eating, amenorrhea, and osteoporosis, and it's combined. Its physical effects that it has on the body primarily comes about restricted calorie intake to reduce or maintain body weight. So that's where the disordered eating comes in. And what that does is the combination of exercise and decreased calories causes increased pituitary gland activity. So that's going to inhibit hypothalamic hormone release, which is going to affect the production of estrogen and progesterone. And that is what's going to cause the disruption in the menstrual cycle, where then you end up with the amenorrhea and or oligomenorrhea. So remember, the amenorrhea is less than 3 cycles per year or lack of menstruation for 3 consecutive months. Oligomenorrhea is 3 to 6 menstrual cycles per year, typically with longer cycles, greater than 35 days. So again, active individuals, they don't eat right, and then that will affect the menstrual cycle. And then we'll also talk about then kind of what goes on as far as the osteoporosis, as far as the decrease in bone mass. So the last part of the female athlete triad, so again, those hormone changes that come about with estrogen and progesterone is also going to affect the calcium depositing in the bone. So that's where the osteoporosis then comes from. Very important, 60 to 70% of the bone mass that individuals acquire is acquired before age 20. So when adolescent females, younger females, end up with this and they get osteoporosis, it really puts them at risk for a lot of potential orthopedic complications. So it's very important that at a young age, the appropriate nutrition, and that the hormone balance isn't thrown off, because it'll end up affecting the bone mass. And it's also important to know that the recovery of bone mass, even with treatment, may not be complete. So obviously we know that young growing individuals, it's very important to maintain their bone mass. So very important to make sure to catch this process early on in a young female athlete. Looking at breast disorders, there's various types of things that could occur with the females with their breasts. Masses, different changes in shape, resiliency, tenderness, discharge, and a lot of these things can be benign. It's not uncommon in younger females to have some benign changes, particularly during their menstrual cycle. A lot of times they refer to this as just proliferative breast changes, where they develop little fibrocystic masses in the breasts that commonly occur with their menstrual cycle. So it's not uncommon to have that happen. Obviously, if there's any major change that occurs, particularly if a woman does have a family history of breast cancer, it would be important to get it checked by the physician. But many times these benign lumps or masses that do occur in younger individuals usually don't cause any problems. Breast pain in general can happen from either direct trauma, so a contusion, or repetitive strain when a female does not have appropriate support for the breast. So just kind of look at The treatment for that, very important that obviously appropriate sports bras are worn to prevent a sprain of the ligament. There's a ligamentous tissue called the Cooper's ligament in the breast that, if appropriate sports bras are not worn, that can cause damage to that ligament. So that takes us to breast cancer. So this is the most common malignancy among women. Risk factors, again, family history, which is very common with any type of cancer. An early onset of menarche, so an early period at a younger age, and a woman that has their first child after the age of 35. So you'll usually see this in women over 40 years of age. So as I had said on the previous slide, a lot of benign changes tend to happen in younger individuals. Again, though, if there's any doubt, or a younger person would have a breast mass and have discharge or a lot of pain associated with it, and particularly a family history, there would certainly be nothing wrong with referring that and getting it checked to make sure that it is a benign mass. Ovarian cysts, so these are fibrous cysts that could form in the ovaries. Many times these are asymptomatic and or benign, meaning that many times females have them and don't even realize it. There is a syndrome called polycystic ovary syndrome. That's when a female has many and very large cysts in the ovaries. You can see a picture of that. So again, understanding the anatomy as we'd gone over earlier, you can see again what a normal ovary looks like and what a polycystic ovary looks like, where there are many cysts forming in there. The main thing associated with this is that a ruptured cyst can cause very severe internal hemorrhage and many times be very painful. So again, something to be aware of in a female. Any lower abdominal pain, particularly in the area of the ovaries and where that pain can be referred, could be indicative of an ovarian cyst. And cervical, ovarian, and uterine cancers. So again, when you're kind of reviewing for your signs and symptoms, try to again understand the signs and symptoms. You see here a picture of what an ovarian cancer would kind of look like with the tumors, and also kind of showing where the cancer would metastasize to. So if you remember what metastasis is when the cancer travels to other parts of the body. So you can see here it metastasized to the spine and liver. This is usually something you would only see in somebody over age 45. However, again, that's just the typical age at which it happens. Again, anytime there would be the potential for any mass that would form in the ovaries, it would be very important to get it checked and examined to make sure that it is not any type of cancer. And with a lot of these in early stages, the prognosis is better. So if this is found early on, this can be treated pretty effectively. Now, looking at some pediatric issues, primary amenorrhea. So we had talked about amenorrhea and what that means for a female who's already had their first period. Primary amenorrhea is when a female has not had their first menstrual cycle by age 16. So at age 16, if they had not had their period yet, they would be considered to have primary amenorrhea at that point. Some other pediatric issues we have kidney trauma, which we're going to talk about at a little more length in a little bit, and talk about why the kidneys would actually be more subject to physical trauma in athletics in younger individuals. Cryptorchidism is when in a male a testicle has not descended from the pelvis. The issue here to be concerned about is that when you have an undescended testicle in a male when they're born, there is a high rate of malignancy, so there's an increased chance of developing testicular cancer, as we had talked about before, when they're older. There's also a chance of infertility, and there's also a chance of that individual being more predisposed to having hernias when they're older as well, just because of some of the structural issues that come about many times when an individual has an undescended testicle. So just to expand on kidney trauma a little bit, because it is a more frequent thing in younger kids than injuries to some of the other organs. Very significant just due to the anatomy. So in younger individuals, the kidneys are more exposed under that costovertebral angle. So until adolescence, the kidneys are actually, in a younger child, much more exposed than they would be. So if you remember going back to the picture that I showed in class, kind of illustrating where the kidneys are relative to the ribs, again, in a younger child, they actually are much more exposed than they are in an adult. So very important that if a child gets a blow to the trunk, you need to make sure that the kidneys have not been traumatized. So it's really important to rule that out, again, through your palpation and through some of the other symptoms that the child may have. And these are the learning outcomes. So again, make sure to review the anatomy and physiology. Go through the things that we had discussed in class. Again, you will have your signs and symptoms as you'll be designing your chart. Again, make sure that you're very thorough in writing down all the necessary information from your textbook. Understand your medical exam procedures. Again, paying particularly close attention to the urinalysis, as I had talked about in class. Make sure you go back and understand what the different parts of the ChemStrip urinalysis, what they test for. So make sure that you're aware of that, because that will be information that will be on the test as well. And again, just thoroughly review your conditions as you're going through your case study work, and we'll talk about more of that in class when we do some of the in-class assignments and case studies.